Welcome for another mind-blowing, eye-tearing, and true-to-life coverage of an unknown disease that struck us. And this is Lifeline.
This story involves explicit contents. Parental guidance is advised.
We all know that Kawasaki is a brand of a vehicle. Yes, it is. But in this case, it's a disease. Kawasaki disease is an illness that involves the skin, the mouth, and the lymph nodes, and mostly often on kids under 5 years old. The cause is unknown. But if the symptoms are recognized early, kids with Kawasaki disease can fully recover within a few days. Untreated, it can lead into serious heart attacks.
Kawasaki disease occurs in 300 out of the whole Filipino population. It is most common among children of Japanese and Korean descent, but can affect all ethnic groups.
Kawasaki disease can be prevented, but usually has the telltale symptoms, signs, that appear in phases. The first phase, which can last up to 2 weeks, usually involves a persistent fever higher than 104 Fahrenheit, or let's say 39 degrees Celsius, and lasts for 5 days.
Other symptoms that typically develop include severe redness in the eyes, a rash on the stomach, chest, and genitals, red, dry, cracked lips, swollen tongue with a white coating and big red bumps, sore, irritated throat, swollen palms of the hands and soles of the feet with a purple-red color, and swollen lymph nodes.
One of the most popular cases was recorded from John Travolta's son. This particular case made Kawasaki disease well exposed to the public. And here's a brief presentation of that said disease.
The teenage son of actor John Travolta died suddenly on Friday during a family vacation in the Bahamas, according to police and the family's lawyer. Jet Travolta, 16, suffered a seizure at his family's vacation home at the Old Bahama Bay Resort on Grand Bahama Island, attorney Michael Lawsey said. The teen apparently hit his head, and a caretaker found him unconscious in the bathroom on Friday morning. He was taken by ambulance to Rand Memorial Hospital in Freeport, where he was pronounced dead, according to a statement from the Royal Bahamas Police Department. 4:00 p.m. Eastern Time. Travolta's attorney Michael Lawsey says Jet suffered a seizure at his family's vacation home at the Old Bahama Bay Hotel on Grand Bahama Island. Attempts to revive him were unsuccessful, and he died on scene. 4:40 p.m. Eastern Time. Restview Memorial Mortuary and Crematorium in the Bahamas tells TMZ Jet's body would be transferred to there on Monday. 4:54 p.m. Eastern Time. A police spokeswoman says Jet hit his head in a bathtub. 5:15 p.m. Eastern Time. Police just released more details. According to a report, Jet was last seen going into the bathroom at their private suite at the Old Bahama Bay Resort sometime yesterday. The body was discovered by the caretaker, Jeff Michael Catherine, at 10:00 a.m. today. The report says Jet suffered from seizures. An autopsy is being performed to determine the exact cause of death. The family, who have homes in California and Florida, arrived in the Bahamas on Tuesday by private plane, police said. Robert Guyton, president of Gin Properties, which owns the Old Bahama Bay Hotel, tells TMZ. The Travolta family has become like family to us at Old Bahama Bay, and we extend our deepest sympathies to them. There have been reports that Jet was autistic, though Travolta has denied it, saying he suffers from Kawasaki syndrome, a condition which often leads to heart disease. Jet, who had a history of seizures, was the eldest child of Travolta and his wife, actress Kelly Preston. They also have an 8-year-old daughter, Ella.
Like the Travolta family, Marcello family was not ready for this kind of a problem. A 10-day disease that cost them an eternity of memory. Just 5 days ago, Yanilex was a perfectly healthy and joyful 4-year-old. Now, he's in a hospital, fighting for his own life. What seemed to be a regular fever and rashes turned into something much more terrible. And no one in the hospital can tell what it is. To define the said disease, here is an expert to tell us about what Kawasaki really is.
There is an illness called Kawasaki disease. It was first described in Japan. This is a disease that, at least as far as we know, has no cause. In other words, we haven't figured out what causes it. It is, however, a serious disease if it goes unrecognized, because it is essentially a disease which can affect the coronary arteries or the blood vessel go to the heart muscle. And these vessels can develop what we call aneurysms, they can develop blockages, and it can be a very, very serious problem. In its classic form, even though there's no one test for it, Kawasaki is fairly easily recognized by the pediatrician. And through the work of people at Boston Children's Hospital, there is a medication, gamma globulin, which if given early can prevent the coronary aneurysms. So the reason it's important to make that diagnosis is because we have a way of not necessarily stopping the illness, but of preventing the cardiac complications of the disease. One of the problems that we're running into now is because of the concern of diagnosing this disease. There's something called incomplete or atypical Kawasaki disease, where you don't have all of the criterion that you described. You may have one or two. Fortunately, the Heart Association has come up with an algorithm or a little roadmap on how to determine which of those children need a cardiac evaluation and which of those children need treatment. This is a very, very useful tool, because what happens is, like any other therapy, gamma globulin is not necessarily benign. There are allergic reactions and problems that develop, so you don't want to overuse it. So by following this little roadmap, you can decide which children have a strong suspicion of Kawasaki and treat, and those that you don't.